The holy grail of Alzheimer's research is to try and find a test that can detect people who are at risk, because as you're aware, the disease actually starts probably 20 years before you see the first clinical symptoms. So what we desperately need is a way to be able to detect this disease many years before the first signs of dementia appear. It would be great if there was a single marker that we could use, but I don't think that's really going to happen. And we believe that by using bioprofiles or a collection of markers in a panel, we can get a robust test that will allow us to identify individuals that are not only suffering, but are also likely to suffer from the disorder in the future. The reason that we need to do this is that there are drugs available at the minute. They've never been tested on people in the early stages of the disease, so if we can find these individuals early enough, they might benefit from the drug therapies that are already available. Certainly new drugs that are coming out, we would want to target to at-risk individuals. The work that we do in the UK is on a par with anything that's done anywhere else in the world, but I think it's fair to say that we do it on a shoestring compared to other countries, and also Alzheimer's research is underfunded compared to other major diseases, yet is one of the biggest burdens on society. We have had substantial fundings from Alzheimer's Research UK over the last decade. They have allowed lots of collaborative projects and standalone work to be conducted in my laboratory here and with collaborators in the UK and throughout the world. It's without a doubt this money has then allowed us to attract funding from external sources, and an example would be the biomarker work that we've been talking about. That was initially funded by AI UK, and on the back of that work, or that priming that allowed us to do, we were able to successfully obtain funding from the Medical Research Council for the next phase of this study. It's absolutely vital that AI UK continue to fund projects at the grassroots level that sometimes might be perceived as being a little bit risky, but if they do work, are likely to have significant impact.